Welcome back to Pittsburgh Living on KDKA TV. I am your host, Carol Lee Espy, and today we are featuring 6 excellent tri-state businesses. Now, coming up, we'll have Dr. Ian Bulow from the Upper Cervical Health Center. We have 3 guests from Pittsburgh Promise, Vibrant Pittsburgh, and Ansaldo. We have Dr. Nathan Lockery from Aspen Dental and Cookie Harris from New Image Hair Clinic. But right now, let's welcome Dr. Jason Tomsic from the Skin Center Medical Spa. Welcome to Pittsburgh Living.
Thank you.
How are you today?
I'm doing fine.
You know, you do so many things there at the Skin Center, but today we're going to concentrate on varicose veins and vein treatment.
That's correct.
Yeah.
And we've been around for about 30 years at the Skin Center, and we do a whole host of things, including cosmetic surgery, skin treatments, Botox injections, fillers, and we also take care of varicose veins.
Well, you're pretty much about aesthetics, then I would say that would.
That's pretty much what we do.
Yeah. Well, let's talk about varicose veins because it's something that, you know, all winter long we've been covered up. And now we're going to put on our shorts, and there may be some things that are appearing that we didn't realize that we had.
That's right.
So, are there several types of varicose veins? Tell me about what we're going to see.
Yeah, there's most of what you'll see are the spider veins. Those are the small little purple or red veins that appear on the skin.
Right.
And that's what a lot of people are worried about when they think about putting shorts on or swimming suits on for the summer. The other thing that you can see is those big bulging veins on people's legs, the ones that look like almost like ropes or snakes underneath their skin. So those are really the 2 appearances that we see people for.
And how do we treat them? I mean, are those 2 types of veins treated separately?
They are treated separately.
Okay.
The underlying cause of those veins is basically the same. It's an increased pressure inside the vein because the valves, the one-way valves that are in the veins, have failed.
Okay.
And once that happens, that blood's allowed to flow in the opposite direction in the vein from what it's supposed to. That increases the pressure inside the vein, and the vein wall can bulge over time.
And that's what causes the big...
That's what causes those big ropey bulging veins that you see. It also causes those small little spider veins that you see too as the walls of those veins expand.
All right. Is that, I mean, is that from people who are on their feet all day? Weight gain? Is it hormonal? Or all those things together?
It's all of the above. There's a strong hereditary component to varicose veins, and about 70% of the people that suffer from vein diseases are because of the hereditary component. We also see it in people who have to do a lot of sitting or standing or heavy lifting over the course of their lifetime. We see it worsen sometimes after pregnancies. We do see it more commonly in women than we do in men, and that is because of the hormonal component.
And they don't go away.
They don't go away. They will not go away on their own. Once that damage is done, that's the way it's going to be.
Okay, so what do you do? What does the Skin Center do to get rid of these?
We have a whole host of options depending on what the underlying cause of the varicose veins are.
Okay, so they have to be assessed.
Yeah. So there's 2 separate reasons that we see people for varicose veins. We see people because they cosmetically don't like the look of the veins on their legs, and then we also see people because they're having symptoms because of the varicose vein.
Okay, is that pain? Do they feel pain?
They feel pain, they feel cramping, they feel restlessness, they can have swelling in their legs, and it's usually worse after they've been on their feet for a long period of time.
Okay.
So a lot of these people, they ache during the day, but they really ache at night. They have difficulty falling asleep at night, and they feel better when they elevate their legs. And so that's one of the telltale signs. So of course, the important thing is to have a complete history to know that we're actually dealing with a problem with the veins and not something else.
Right. Okay. So what do you do? Let's start with the spider veins. How do you treat the spider veins?
Well, the spider veins are injected with a sclerosing agent. And what that does is it causes an irritation in the wall of that vein and will cause it to collapse down on itself.
And they just flatten.
Then flatten. And the body has to absorb that. You're going to see the vein go away almost immediately. And then it sort of comes back looking a little bit irritated. And it may take a few weeks to completely go away and become the same color as your skin. Now, the important thing is that those spider veins they can be a sign that there's something going on and a vein deeper in your leg. And so that's where an ultrasound becomes very important, especially in people who are having a lot of symptoms in their legs as well. We want to do an ultrasound of the veins, the saphenous veins, the short and the great saphenous vein, to make sure that the valves in those veins are working correctly and there's not reflux in those veins. Because if there is, that
it's a bigger problem.
Takes our treatment in a different direction.
Which is you're catching something at that point.
Exactly.
Yeah, that's actually a very good thing. Instead of
Right.
it being just a cosmetic procedure, you may be catching something
Right.
of a deeper problem. Okay.
Exactly.
So let's just say it's just a spider vein and there's not a problem with it, so you collapse it and
We can do a series
They
of
go away.
injections on those
Okay.
veins, depending on how many of them you have. We can take
Okay.
care of a large number of them at one time.
Okay.
It may take a few sessions to actually get all of them to respond and
Right.
go away.
Right.
But that's probably one of the simpler things that we do at the Skin Center
Okay.
as far as vein treatments go.
Now the larger ropey veins that you were talking about, that's a different treatment?
That's a different
Okay.
treatment. In order to take care of those veins, we have to do a microphlebectomy.
Okay.
And the way that's done is numbing medication is placed in the skin around that vein. There's small incisions that are made in the skin, and then that vein is removed with microphlebectomy tools. It's actually pulled out in small little pieces. There aren't any stitches involved with that process.
Okay.
There's little paper strips that go over top of the incisions. You can go home the same day. You have to wear a compression stocking for about a week, and then get back to normal activity pretty quickly.
Now I'm sure you hear this question all the time. It's like, what if I need that vein? Do I need that vein, or can the vein go away and it's not a problem?
The vein can go away
Yeah.
and it's not a problem.
Yeah.
These veins, they're diseased. The blood gets
Right, so it's
rerouted.
already done its own work out there.
Yeah, it's going to get rerouted through the other normal veins that
Right.
are there, and it's going to get back, to the vein that it needs to get to in order to get
Right.
back to the heart.
The body always finds a way, doesn't it?
It does.
Yes. Okay, so tell us, once this is all finished, is there a problem with it? So that vein is, the one vein is gone, it's gone into the other areas, so are you pretty much have cleared up what the problem is there, or is this an ongoing process?
For some people, it can be an ongoing process.
Yeah.
If there's a strong hereditary component to it,
Yeah.
and they've only got reflux in one of the veins that usually causes a problem,
Yeah.
they may
This is
develop problems in the other veins in their
Something to
legs.
keep an eye on.
But there's important things that you can do. You can try to avoid standing or sitting for
Right.
prolonged periods of time if you can. Some people just can't because of their vocation.
Yeah.
The other thing that's very important is exercise. Exercise helps with the health of the veins. As the muscles in the legs squeeze, it pushes blood up through that vein in the proper way that it's supposed to. Exercising those valves, getting them to open and close the way that they're supposed to.
Now, how many facilities do you have?
We have 3 separate locations. So we have one in Shadyside, one in Wexford, and one in Mount Lebanon. All of our vein procedures are done at the Mount Lebanon office, but
Okay.
we do see patients and do consults at the other 2 offices as well. Now, those injections for the spider veins, those can be done at any of the
They can be
3
done
offices.
anywhere, but if they're going to do the other procedure,
Right.
they can...
One of the other things that we do offer is for vein reflux and the great or short saphenous vein, we do offer endovenous laser therapy. And what that involves is it's all done under local anesthetic as well. It takes approximately 40 minutes to an hour to treat a vein. And we place a laser catheter into that vein. And the heat from the laser catheter is what helps to close that vein down. And then the blood gets rerouted through the other normal veins that are there. And the beauty of that procedure is that it takes the place of the vein stripping procedure that was done in the past.
Right.
During the vein stripping procedure, you had to have incisions in your leg. You had to be under general or spinal anesthesia.
And now
and
that's gone.
you had downtime. You were usually in the hospital for a few days.
Yeah.
The beauty of the laser therapy is you walk out the same day right after you have your procedure. You can go back to work depending on what kind of job you do the same day or the next day.
Wonderful. It's amazing. I mean, because for years and years you just had to live with it, and it's come so far in all the procedures that we do.
That's one of the things that I hear when I see patients at the Skin Center is, my mother had these, but she never did anything about them.
Or couldn't.
And
I mean, there wasn't anything they could do.
If you did, it was much bigger undertaking than it is now.
Absolutely.
Most of the
Wonderful.
procedures that we do on veins are minimally invasive these days.
Well, thank you so much for being with us, and we have all your information on the screen. We have your website and your phone number. So
All
thank
right,
you so
perfect.
much, Dr. Thompson.
Thank you.
Now, if you'd like to know more about the Skin Center Medical Spa, you can just call Dr. Tomsic at 1-800-429-1151, or you can log on to theskincentermd.com. Now, if you'd like to advertise your products or services on Pittsburgh Living, you can give us a call at 412-575-2400, or you can email us at showcase@kdka.com.